Tehran, as Iran faces what looks like its worst wave of the coronavirus pandemic yet, Tehran commuters still pour into its subway system and buses each working day, even as images of the gasping ill are repeatedly shown on state television every night. After facing criticism for downplaying the virus last year, Iranian authorities have put partial lockdowns and other measures back in place to try and slow the virus spread. But in this nation of 84 million people, which faces crushing us sanctions, many struggle to earn enough to feed their families. Economic pressure, coupled with the growing uncertainty over when vaccines will be widely available in the Islamic Republic, have many simply giving up on social distancing, considering it an unaffordable luxury. That as public health officials worried the worst of the pandemic still may be yet to come. "I cannot stop working," said Mustafa Shani, a worried 34-year-old construction worker in Tehran. "If I do, I can't bring home bread for my wife and 2 kids." Iran is now reporting its highest ever new coronavirus case numbers, more than a day. Its daily death toll has surged to around 400, still below the grim record of 486 it reached in November. During the peak of Iran's last surge, around coronavirus patients were hospitalized across the country. Today, that figure has topped. The health ministry warns the number will climb too in the coming weeks. Iran remains among the hardest hit countries in the world and the worst hit in the Middle East. Across Tehran, Associated Press journalists have seen signs of the pandemic stall. At Tehran's Shohadeh Tigrish hospital, orderlies pushed the bodies of 2 victims of the coronavirus across a parking lot to its morgue, one wrapped in white, the other in a black body bag. All of its wards on 5 floors of the hospital are reserved for coronavirus patients. One empty gurney held a bouquet of roses left for a recently deceased man. A heart-shaped balloon hovered over a still respirator. At the massive Bahishti-Zara cemetery, already reeling from the pandemic, workers laid cinder block rows of new graves. Mourners in black wept at a stream of funerals. Officials plan to open a new morgue at the site to handle the wave of death, much wrought by what Iranians simply call corona. Saeed Kal, the director of Tehran's main cemetery, said workers buried 350 bodies there on Tuesday alone. At least 150 had died of coronavirus. The cemetery had never processed that many burials in a single day, not even during Iran's war with Iraq in the 1980s that saw 1 million people killed. "It was one of the hardest and saddest days for my colleagues in the half-century history of the cemetery," Kal told State TV. "So much is the influx that some burials are being delayed by a day, unusual for Iran, which follows the Islamic practice of immediately burying the dead." Outside the gates of Tehran's Imam Khomeini hospital complex, where the capital's poor can receive free treatment at its beds, scores crowded around one recent day as guards turned away routine cases and allowed in only test-confirmed coronavirus cases. "They say the wards are full of corona patients," said manager Tahari, who sought a regular thyroid treatment for her mother at the hospital. "I have no idea where to take her when such a huge complex has no place for my mother." Field hospitals are being prepared in Tehran and other major cities. State TV has shown images of hospitals outside the capital with patients being treated in hallways. "We are not going out of the red zone anytime soon," Deputy Health Minister Ali Reza Raisi told state media. President Hassan Rouhani blames the current surge on the fast-spreading variant of the virus first found in Britain, which the government says arrived from neighboring Iraq. Travel between the countries has been restricted since March, though people and commerce continue to cross each day. Overall, Iran has seen 2.2 million reported cases and deaths in total. Lawmaker Jalil Rahimi Jahanabadi blamed government mismanagement and continued us sanctions for the virus spread. "Sanctions, challenges and wrong decisions will continue. We do not have sufficient vaccines, so protect yourself and your relatives through personal health measures," he wrote on Twitter. As of now, Iran has administered over vaccine doses according to the WHO. Supplies, however, remain limited. Iran's supreme leader Ayatollah Ali Khamenei has banned US and British-made coronavirus vaccines, saying their import is forbidden because he does not trust those nations. Khamenei has approved the import of vaccines from safe countries, such as China and Russia, and has backed national efforts to produce a homegrown vaccine with help from Cuba. But officials keep changing when they say the wider public will be vaccinated, as it remains unclear when Tehran will have a promised 60 million doses of Russia's Sputnik V vaccine. Amir Afkhami, an associate professor at George Washington University, said that over the past year, Iran's leadership could point to superpowers like the US struggling to contain the virus. With vaccines rolled out in the Western economies reopening, this could become much more difficult to do, he said. Ultimately, Iran is not self-sufficient when it comes to COVID-19 vaccine development, and it doesn't have the intensive care unit beds to absorb the patients it needs to, so it really needs external help, Afkhami said. Authorities across Iran have closed mosques, restaurants and parks during Ramadan, the Islamic holy fasting month being observed by Muslims around the world. An evening curfew for private cars is in place and travel between cities is banned. Parliament has been suspended for 2 weeks. But the wider fatigue from the virus has seen people ignore warnings and host fast-breaking meals known as iftars indoors. Already, authorities blamed celebrations around the Iranian New Year known as Nowruz in March for contributing to this wave. Masoud Mardani, an infectious disease specialist on Iran's COVID-19 National Task Force, has demanded a public curfew. But none so far has come.